I love my job. Despite what you may think, radiology isn't perfect. Today I'm going to discuss a few things that I really dislike about radiology. I've done a video on the things that I really love about radiology, and that's definitely worth checking out, but I thought it's only fair that we discuss some of the cons. Starting with one of the most stereotypical things about radiologists is that they love, for some reason, the dark. Now, this is something I've never really understood. Why do radiologists sit in the dark? I get it back in the day when you were looking at actual copies of plain films. You needed the darkness to really get your eye in to see the findings. But look, we're living in 2026. We have computer screens. You can up the brightness on the computer screens. I don't get why radiologists love reporting in the dark, and I think it's just genuinely a bad habit that's carried on from the past. The first thing I do as I walk into a reporting room is I turn the lights up, and a lot of my colleagues don't like that. So yeah, darkness, really not for me. One of the things I hate the most about radiology is dealing with difficult colleagues. No doubt, most of the people I work with are lovely, but there's always those few minority interactions which can just completely ruin your whole day. And this comes in different shapes and sizes, but the most annoying one is dealing with irritating individuals outside your specialty who treat you like you are a slave to them. No doubt radiology is there to help, and I get the pressures that exist around the hospital, and we try and do as much as we can, and we're trying to help come to a diagnosis. But some doctors call you up, rude, can we order a scan, as if I'm some sort of pizza delivery service. But hey look, I've trained, I've spent years in this trade, and thank God, got to where I am, and I can provide my input and my expertise, but we aren't just going to bend to whatever someone asks us to do. And I think that's one of the biggest pet peeves of radiologists, is when other doctors just treat us with a complete lack of respect. Another side to this is when doctors request scans, they're supposed to give us the relevant clinical information, i.e. they need to tell us radiologists why they want the scan done. But what will often happen is you'll get the most sparse, useless information. So an example, a patient will come in with abdominal pain, and they may have appendicitis, but what the clinician may put down on the clinical indication is query pathology, as if that's of any use to me. And what that means is now I need to go dig through the notes and find out why has this scan actually been done. And that's another huge pet peeve. Third, radiology is damn hard. So when you start out your training, you're pretty much like a medical student all over again, because let's be honest, doctors in general don't know a huge amount about radiology and how to interpret images. So what happens is you're sat there for pretty much a year shadowing the senior doctors, like the consultant, and that is very, very boring. I mean, I spent a lot of my time kind of nodding off to sleep behind a consultant's back and trying to drink copious amounts of caffeine to stay awake. That's just the nature of the job, and I think everyone goes through this crisis in the first year where they kind of want to quit because it just sucks. But when you push through that, it does get better. The other thing is the exams are probably one of the hardest across all of the specialties, and that's just because of the breadth of knowledge that you need to cover. However, I will say the physics exam that we sit is a waste of time. I don't know why we need to learn all the nitty-gritty physics of the scanners. It's not like physics at school where some of it's actually quite useful, like speed equals distance over time. That's useful. I use that still today. But in radiology physics, you're learning about the reconstruction algorithms of how the MRI software takes the data and spits it out and makes an image. Like, that for me is just useless and a waste of time, aside from the basics, which were somewhat useful. And that really, really frustrated me because I felt like I just wasted months revising for this exam. And sure, thank God I did pass, but I've never really used any of that knowledge to this day. Then once you've done your exams, you've gone through that medical student phase, you start to become senior, and people rely on your reports. And this is difficult because what you say, people will act on. So if you say this patient has cancer, or you say this patient has appendicitis, or this patient needs to be taken to surgery, the patient will probably be taken to surgery. And if they then open up the patient and find you were just talking absolute nonsense, then that looks really bad on you. So that's the thing I find difficult, is what you say people take really seriously. And the other thing is sometimes there are grey areas, like you're just not sure, does this patient have, for example, cancer, or do they not have cancer? And you need to be able to communicate really, really clearly in radiology to make sure you get that across to the clinician, because quite often your word is taken as pure truth. Fourth are the on-calls. So thankfully now that I've done my training, I don't really need to do as many of these, but the on-calls are difficult. Now, you are sat down and you are looking at pictures and you are drinking tea, so hey, it's not that bad. But the thing about radiology on-calls is you can't switch off. you need to be concentrating non-stop, because if you turn away for a second or you blink, you literally might miss a nodule which could turn into cancer, or you might miss a bleed in the brain which is really subtle. So, you know, for the first couple of hours of the 12-hour on-call shift, that's fine. But when it gets to like 3 or 4 o'clock in the morning and you're looking at your 30th CT head, it gets really, really tiresome. And it is mentally draining. After an on-call shift, you come back home, you might not be physically tired, but you just feel mentally drained. And it's that level of concentration, particularly for someone like me who gets distracted by like a fly on the wall, that is quite challenging. And on that note, because radiology is one of those specialties where everything is written down electronically for people to see, if you do have a lapse of concentration and you do miss something, it's kind of there for everyone to see down the line, years down the line even. And there's always that one annoying guy who will message you after an on-call shift being like, hey, I think you missed this. And in general, actually, you know, sometimes people do it in a constructive way and that's welcomed, and I very much appreciate that. But sometimes people are just doing it to kind of show you up or have a go at you, and that's what I don't appreciate. But again, they are in the minority. Finally is lack of patient contact. Now, I do miss seeing patients, and there's something nice about dealing with a problem face to face and actually being directly involved in patient care. Radiology is much more behind the scenes, and you're a bit like the loser in the closet that no one really knows about. You know, there's something really nice about being there in A&E or being the surgeon opening the patient up and dealing with the problem there and then. You do lose that, but radiology is super valuable. Look, without the scans, you're not going to get the diagnosis, and without the diagnosis, you're not going to be able to treat the patient. But you just have to be comfortable with the fact that you're not really going to be dealing with patients day to day. And much the same is actually patients don't really understand what radiologists do. Sometimes when I'm speaking to friends or relatives, they're like, hey, look, Shoaib, what do you do? I'm like, oh, well, you know, I'm a radiologist, so I look at pictures of people's insides and I come up with a diagnosis. I'm like, okay, do you not treat patients? Well, no, not really. I mean, I make radiology reports, so that's where I tell people what the diagnosis is. Okay, so what do you do after that? Oh, I just make another report and I look at another scan. So you kind of get the gist. Is like, it's a bit lame when you explain it to people. It's not exciting. It's not that adrenaline rush that you get in A&E or that you see on TV. But you know, you just need to be comfortable with that. And I think I actually prefer that. My personality is much more suited to kind of being sat down behind the scenes and away from all the manic of the wards. So that is a summary of my pet peeves in radiology. I hope that hasn't put you off. And in my opinion, radiology is still the best specialty to do. If I had to go back again, back to 2020 when I was applying, I would still do radiology all over again. So I hope you found that useful, and stay tuned for more content.